Can Paget's disease cause hearing loss? Have you ever wondered if Paget's disease can affect your hearing? The answer is yes, it can. Paget's disease is a condition that leads to abnormal bone remodeling, and when it impacts the temporal bone, it can disrupt hearing. The temporal bone is crucial because it houses structures that are essential for hearing. When Paget's disease causes the bone to thicken and distort, it can interfere with the normal anatomy and function of the inner ear. This can happen in a few different ways. One way is through mechanical compression. The thickened bone can press on the tiny bones in the ear, known as ossicles, which are responsible for transmitting sound vibrations. If these bones cannot move freely, it can restrict sound conduction and lead to hearing loss. Another way this can occur is through nerve compression. The abnormal growth of bone can press on the auditory nerve fibers. These fibers are responsible for sending sound signals from the ear to the brain. When they are compressed, it can result in sensorineural hearing loss, which is a type of hearing loss that occurs due to issues with the inner ear or the auditory nerve. Additionally, changes in the bone mineral density of the cochlear capsule, which surrounds the cochlea, can also contribute to hearing loss. This can affect high-frequency hearing and create an air-bone gap, indicating a conductive component to the hearing impairment. Research shows that the primary site of hearing loss related to Paget's disease is in the cochlea, rather than beyond it, such as in the auditory nerve. There is no consistent evidence of damage to the auditory hair cells or nerve cells themselves. Hearing loss from Paget's disease can also come with other symptoms like tinnitus, which is a ringing in the ears, and balance problems due to involvement of the vestibular system. When we consider osteoporosis and related bone conditions, Paget's disease is a bit different. Osteoporosis is characterized by decreased bone density, while Paget's disease involves localized abnormal bone turnover. Both conditions can affect bone integrity and have systemic effects, but Paget's disease can directly impact hearing in a unique way. It is important for healthcare professionals to recognize hearing loss as a potential complication of Paget's disease. Timely diagnosis and management are crucial. Treatment may include medical therapies to control bone turnover and interventions to address hearing impairment. If you notice any changes in your hearing, it is essential to consult a healthcare professional for proper evaluation and treatment.